The Republican health care bill that passed the House is already spooking millions of Americans, as well as the insurance companies. What it would do, among other things, is leave more than 10 million people uninsured just next year. And many carriers, they're planning to pull out of some states due to the uncertainty and lack of subsidies in that Republican proposal. Here is how the Comptroller of Connecticut, Kevin Lembo, described it in an op-ed in the Connecticut Post. Quote, "The American Health Care Act recently passed by the House of Representatives and proposals now under consideration by Republican senators are simply not health care reform, but instead an immoral and outrageous attack on millions of Americans at risk of losing access to health care, particularly those with pre-existing conditions." Well, Andrew spoke with the Comptroller earlier today.
Connecticut State Comptroller Kevin Lembo, thank you so much for joining us. Appreciate it. A few minutes.
It's good to be here.
So I take it from the quotes that we just read from your op-ed in the Connecticut Times, not a big fan of the American Health Care Act, the Republican health care plan.
Well, everything old is new again. This idea that somehow high-risk pools are going to save the day, that extraordinary premiums for people with pre-existing conditions, while they technically can get health care, but it is unaffordable. We've been through all of this, not only as a state, but as a country. So there's not a lot of there, as they say.
We've heard about the potential impact of the AHCA on individuals. Premium hikes, the high-risk pools, people with pre-existing conditions might get hurt. I'm curious, though, as a state comptroller, do you know yet what the impact of the AHCA would be on Connecticut itself, the budget and the bottom line for the state?
I can't quantify it right now, but I'm going to tell you the categories are loss of coverage by folks who will now show up in our hospitals and emergency rooms seeking care at the worst possible time to be seeking care. It's going to add cost to the system where there isn't cost now. We have subsidies coming in for a whole group of people who won't have those subsidies any longer. As your uninsurance rate rises, there are many, many costs to the system, not even counting the human toll that takes on people who no longer can see a doctor when they need to.
There's also an anticipation that the AHCA would reduce the total payments from Medicaid to individual states. That would mean that either the state would have to, provide fewer benefits or cover fewer people. Is that factor? Would that also impact the state?
It would have to factor in a state like Connecticut, where the budget is still in crisis. There isn't exactly excess revenue laying around to now turn for that purpose. But it is clearly going to be a part of the larger problem.
Now, the AHCA is being promoted by Republicans in Washington as an alternative to the Affordable Care Act, the ACA, yeah, which they say is failing or is in verge of completely failing. What are the negative aspects or impacts if Connecticut continues to operate under the ACA?
Well, it really would depend on what the final language actually looks like. It looks like the Senate has talked about unpacking it completely and repacking the bill in a different way. We'll have to see what that looks like.
No, I'm saying if we stuck with the Affordable Care Act.
Okay, so we have a problem in the exchange right now. We have 2 carriers left in Connecticut. We have a number that have abandoned the exchange, not so much because they were not gaining access to the population and a risk profile of that group that actually helped them to balance all of the risk, but because of clawback provisions in Medicare and other elements of the Affordable Care Act or Obamacare that actually made it hard for them to operate in that space. Those, in fact, were Republican amendments on the Affordable Care Act that the Democratic Congress allowed them to attach.
So it's not so much that the Affordable Care Act is itself in a precarious position. You're saying that it hasn't been kept up properly?
I'm saying that the basic design of it had flaws, and those haven't been corrected. And until they are, that marketplace approach really is not viable.
Your piece in the Connecticut Post also promoted the public option as a potential option for the state of Connecticut. Remind our viewers, what is the public option when it comes to health care?
Well, look, that could be defined differently in different states. In Connecticut, our view and mine is that it would mean taking our existing purchasing, in this case our Medicaid population and our state employee retiree plans, trying to bring the heft of those 2 programs together and then offer an opportunity for others outside of the Medicaid and state employee plan to be able to buy in at a premium into that plan. When you look at my plan that I run through my office, which is the state employee retiree system, we have a medical trend, the increase in price from year to year of 4, 5, or 6%. You talk to any private employer in this part of the country, they're not seeing increases of 4, 5, and 6%. They're seeing 10, 12, 15. We are actually running a highly efficient, very effective health plan. Why not make it available to others, assuming the premium could cover the cost of their care?
Where does the state stand in terms of the political will to consider the public option at this point? It really has not been on the radar in a lot of cases. And I'm also curious what the impact would be on health insurance companies. Connecticut is known as the capital of insurance, and even Aetna, one of the largest employers in the state, is leaving Connecticut, leaving Hartford, probably for Boston or New York.
And simultaneously saying that the country needs to look at a single payer and a public option as they're talking about downsizing from the Connecticut market. So these are parallel conversations, but not actually ones that cancel each other out. There isn't necessarily the will, I think, in the legislature at this point in Connecticut to move this forward, but that's going to take some modeling. It's going to take some consensus-driven leadership, and we're going to have to provide an alternative option to people who may in fact be about to lose their care through the Affordable Care Act when and if the ACA actually comes into existence, and that's an open question as well.
People hearing so many negative things about the AHCA, the Republican plan, and the ACA, Obamacare. You think there might be a window of opportunity here for a third way to go, a public option?
I think it's going to fall back to the states to figure this out. There was big wholesale change at the federal level. Some of it worked well, other parts of it didn't. This is the time that states can once again be the laboratories of innovation, and it's going to really be up to governors and legislatures to try to chart a path forward.
Well, congratulations on sparking the debate on this to a certain degree in Connecticut, and thank you for giving us a few minutes to discuss it here today. Appreciate it.
Happy to be here. Thank you.
Connecticut State Comptroller Kevin Lembo, thanks very much. Appreciate it.
And up next, Donald Trump keeps saying that he cannot release his tax returns because he's under audit. And then he says even after that, he may not release them at all. We're going to speak to a local lawmaker with a bill that would get those returns released.